Otorhinolaryngology, also known as ear, nose, and throat, ENT, medicine, is a fascinating field that deals with the diagnosis and treatment of disorders and conditions affecting the head and neck region. One common condition that we encounter in our practice is septal hematoma, a collection of blood within the nasal septum. In this script, we will delve into the intricate details surrounding septal hematoma, from its anatomical considerations to its management and long-term outcomes. The nasal septum, composed of cartilage and bone, divides the nasal cavity into two halves. Understanding the nasal anatomy is crucial in comprehending the predisposing factors for septal hematoma. The nasal septum is richly vascularized, receiving blood supply from various arteries, including the anterior ethmoidal artery, sphenopalatine artery, and greater palatine artery. These arteries anastomose within the septum, forming an intricate network susceptible to trauma-induced bleeding. Septal hematoma typically occurs following trauma to the nasal septum, such as a direct blow to the nose. The force disrupts the fragile blood vessels within the septum, leading to bleeding and subsequent hematoma formation. It is important to identify the mechanisms of injury to assess the severity of the hematoma and guide appropriate management strategies. Hemostasis, the process of stopping bleeding, plays a vital role in the formation and resolution of septal hematoma. Coagulation factors, including platelets and clotting factors, are crucial in achieving hemostasis. Disorders of coagulation, such as hemophilia or the use of anticoagulant medications, may increase the risk of septal hematoma formation and impact the efficacy of treatment. Nasal endoscopy, a minimally invasive procedure, provides a visual assessment of the nasal cavity, including the septum. It allows for the direct visualization of the hematoma, assessment of its size and location, and identification of any associated complications. Nasal endoscopy plays a pivotal role in the accurate diagnosis and subsequent management of septal hematoma. Radiological imaging, such as CT scans and MRI, can provide additional information about septal hematoma. These imaging modalities help evaluate the extent of the hematoma, assess damage to surrounding structures, and identify any underlying bony abnormalities. Understanding the role of radiological imaging is essential in comprehensive evaluation and treatment planning. Surgical intervention is often required for the management of septal hematoma. Different techniques aim to evacuate the accumulated blood, alleviate symptoms, and prevent complications. Drainage procedures involve incisions or needle aspiration to remove the hematoma and restore normal septal anatomy. In some cases, the placement of drains may be necessary to facilitate proper drainage and prevent reaccumulation. Preserving the structural integrity of the nasal septum is crucial in managing septal hematoma. Cartilage preservation techniques aim to minimize damage to the septal framework while effectively treating the hematoma. These techniques may involve careful dissection, meticulous hemostasis, and the use of grafts or splints to maintain nasal support and prevent deformities. Following surgical intervention, postoperative management plays a critical role in achieving optimal outcomes. Tissue adhesives and nasal packing serve as effective strategies to control bleeding, provide support to the nasal septum, and promote wound healing. Understanding the various options available and their indications is essential for successful postoperative management. Though rare, complications can arise following the treatment of septal hematoma. These may include infection, septal perforation, or cosmetic deformity. Recognizing the signs and symptoms of these complications and implementing appropriate management strategies is crucial in achieving successful outcomes and patient satisfaction. Assessing the long-term functional and cosmetic outcomes in patients with septal hematoma is essential in determining the success of treatment. Rehabilitation may involve evaluating nasal airflow, assessing olfaction, and addressing any persistent symptoms. Achieving optimal nasal function and satisfactory cosmetic appearance are the goals of comprehensive rehabilitation. Recent advances in medical technology have paved the way for alternative treatment modalities in managing septal hematoma. Platelet-rich plasma, PRP, therapy and stem cell therapy hold promise in accelerating wound healing, reducing inflammation, and promoting optimal tissue regeneration. These emerging treatment options require further research and study to establish their effectiveness and safety. Ongoing research initiatives focus on enhancing our understanding of septal hematoma, its risk factors, and prevention strategies. Novel preventive measures, such as protective gear and educational campaigns, may reduce the incidence of septal hematoma. Additionally, therapeutic advancements, including targeted drug therapies and surgical techniques, aim to improve outcomes and enhance patient care. In conclusion, septal hematoma is a complex condition in otorhinolaryngology. A thorough understanding of nasal anatomy, injury mechanisms, and management is crucial for physicians. Continued learning and advancements in diagnostics, surgeries, and rehabilitation aim for better outcomes and patient satisfaction.